Hi everyone, and welcome to the third in the series of the LSN's Ask the Expert videos. I'm Anita Wallace, Chair of the Lymphedema Support Network, and I'm delighted today to introduce you to the LSN's nurse advisor, Denise Hardy, who runs a very busy practice in Kendal, and she's very, very experienced. So I'm delighted that she's agreed to come on with us, and we'll get going on the questions. So Denise, what are your 5 top tips for managing lymphedema?
Oh, narrow it down.
Top tips.
Okay, first one I think is knowledge about your condition.
Okay.
For me, when I see somebody for the first time who knows nothing about lymphedema, they're like blown away by what it is and what it's all about. So that to me is important, them learning about lymphedema in the first place, what it is, why they've got it, and what they're going to do about it. At the end of the day, I want that patient to become an expert in managing their own condition. And the assessment is the very first step of that. And there's a long journey.
Yeah.
Our patients usually stay on our books for about 12 to 18 months, and then we discharge them as an expert. And we discharge them as an expert when I know they can answer all the questions that I have written on my lymphedema sheet. So that is that, you know, they're looking after their skin, they exercise, they know their compression, etc. They're an expert, they know as much about it as I do, and then I'll discharge them. So the first one is learn about your condition.
Yes.
Okay. Number 2 is the risk of infection. Reduce the risk of infection as much as you possibly can. So that is keeping your skin in tip-top condition. And we've talked in earlier questions about the best creams and things to use for that. And it is about just finding something that works for you. What's the best cream or lotion that keeps your skin soft and supple? And then, of course, not to damage the skin. It's knowing what may cause an infection. And then if you get an infection, what to do about it. So that's my second one, is knowledge and information about looking after the skin and reducing the risk of infection, and then managing it should you unfortunately get one.
Okay, thank you.
Number 3 is the best possible compression for you. Now, compression is a minefield in lymphedema. I can't tell you how many different varieties there are. And what's going to suit you isn't going to suit somebody else. So it's about working together and finding out the best one. And that's not easy, particularly as, you know, you're only allowed 2 garments every 6 months. So we have to try and get it right as soon as we possibly can. But it has to be something that you're going to wear. Because if I get something prescribed for you that you hate, you just won't wear it.
Yeah.
And if you don't wear it, your lymphedema is not going to respond. So that's vital for me, is getting a good compression garment that is going to be the most effective at managing your lymphedema, that you'll wear and that'll do the job. So good compression. Number 4 is keep moving. I don't want you running around the block, that doesn't matter, but just keep moving. Exercise if you like it, but to me, if you can do that with your garment on, that'll be fantastic. You will get the optimum reduction in that limb. So moving with compression alongside the skincare is again another important point. And the last one is maintaining a healthy weight for you. So I'm not saying, you know, I want you on a huge diet. You might have always been the weight that you are. Yeah, if that's too heavy, then I might be saying, you know, try and lose a little bit, but it's maintaining that normal, healthy weight for you. And that's by adopting a healthy eating program. So yeah, those are my top tips: education, reducing the risk of infection, good compression, keep moving, and maintaining a healthy weight.
Brilliant. Thank you, Denise. Thank you. And that's the last in our series of questions with you. And thank you so much for agreeing to take part. It's been really, really interesting. Very interesting. Thank you.
You're very welcome. It's the longest conversation we've had for ages. So
it is indeed. It is indeed. Well, bye for now, Denise, and see you soon. Bye-bye.